Hello everyone, and thank you for sending us your questions. I will respond to some of your questions here, and you can find the rest in our previous Q&A post on our social media feed. The most common co-infections are Bartonella and Babesia. We also see tick-borne relapsing fever, which is mostly associated with Borrelia hermsii, as well as Rocky-Mountain spotted fever, which is Rickettsia, and Rickettsia rickettsii, Ehrlichia, viral infections such as cytomegalovirus, Epstein-Barr virus, Coxsackie, and Powassan virus. Additionally, patients often develop anemia, low white blood cell count, and chronic inflammation. Other medical conditions associated with Lyme disease include inflammatory demyelinating neuropathy, mast cell activating syndrome, pediatric acute onset nodopsychiatric syndrome, and radiculopathy, among the most common. Some initial symptoms include headaches, joint pain, fever, and fatigue. In chronic cases, other symptoms can arise, such as brain fog, confusion, muscle twitching, weakness, visual disturbances, and even seizures. The best way to get diagnosed is to analyze the patient's risk factors, such as places they have been, exposure to ticks, clinical symptoms, and lab results such as the ELISA test, the Western blot, and PCR, and a complete blood count to evaluate the immune system. Ultimately, the diagnosis is clinical, but it is best to support it with the right laboratory and imaging tests. Typically, Babesia is caused by the strain Microti duncani in humans. However, recent studies have shown that the odocoiline strain is also related to human disease and can be as severe or even worse than other strains of Babesia. In these cases, we study the patient's blood based on PCR analysis and DNA sequencing. Once diagnosed, we treat it using a combination of intravenous antimalarials, biofilm treatment, and in severe cases, we proceed with red cell exchange therapy to remove the parasites circulating in the blood while administering antimicrobial therapy. Tinnitus can be a sign of inflammation along with chronic headaches. It is important to rule out possible neurological changes in the brain with an MRI or a CT scan. If no structural damage is found and the patient has already tried anti-inflammatory therapy, vagus nerve stimulation, VNS, may provide benefits. VNS is a non-invasive procedure that delivers electrical impulses to the vagus nerve, and it is used to reduce the frequency and severity of attacks. Another treatment option is sphenoidal exosome therapy, a recent option for cases that have not improved with other treatments. This therapy has anti-inflammatory effects, it helps in tissue repair, and it can influence pain signaling pathways by delivering specific microRNAs and proteins to modulate the activity of neurons involved in pain perception. Isn't this fascinating? Thank you all for tuning in. We hope you enjoyed this Q&A. Until next time.